I'm pleased to open this important workshop for the pathology laboratory services in the ministry. In the notes that I was given, I was informed that in this workshop you basically have two objectives. The first objective is to review your quality management system. To review that copy of, and of course when we're talking about reviewing any quality management system, we're talking about looking at three things: how suitable the system is, how adequate it is, and how effective it is. So that's going to be a very important discussion that you have today. Is it suitable? Is it suitable for your purpose? Is it adequate? And is it effective? And effectiveness is all about delivering what you want it to deliver. Fitness for purpose. Is it fit for your purpose? And I understand that the second part of your exercise today will be to look to linking your discussions here to the ministry strategic plan that will be running from 2016 to 2020. We'll have a ministry strategic plan, and in the laboratories, in the pathology section, how you in this unit will contribute towards the development of the overall objectives of our strategic plan. That's going to be an interesting exercise because our strategic plan, I think, is almost, 95% done, almost complete, but most of the components are there. And I think I'm very glad to see that even though we're in the process of not finalizing our overall strategic plan for the ministry, you're already thinking about how the different components of the ministry can latch on and identify what their role is in making that overall strategic plan success. I was also given some notes on the history of your quality management system in the laboratory system. And I'm very glad to see the developments of the past few years. I have seen here that it was introduced in 2002 at the CWM hospital, where they had identified lots of weaknesses in the key processes of laboratory service. A lot of these weaknesses were unearthed, and it was noticed that there was a lack of guidelines and standing operating procedures for most of your laboratory processes. You had appointed a part-time quality manager at that time. Training had started, and implementing of the quality management system only took place initially at the CWM hospital and the laboratories there. As the quality management system gradually settled in, the gap in quality management and quality assurance between CWM laboratory and the laboratories in divisional hospitals, subdivisional hospitals, and specialized hospitals at Mataika House and the Daulako Mycobacterium Reference Laboratory. I hope I've got that right. I keep saying these big words, medical words. I have to practice myself how to say them out. Became more apparent. Further collaboration with the World Health Organization, something we're always very thankful for. The assistance for the World Health Organization resulted in the decision to lobby for global fund support in 2008 with the understanding that the laboratories will not be able to adequately support the two disease programs, namely TB and HIV, without the implementation of the laboratory quality management system. This lobby resulted in the award of the Laboratory Health System Strengthening Program in Fiji under the Global Fund TB grant. So we're very thankful to the WHO, we're very thankful to the Global Fund for helping us to put this in place and to make our quality management system a reality in our laboratories. I've got some notes here on the achievements. With the Global Fund support, the laboratory quality management system has been successfully rolled out to all pathology laboratories in the ministry in the last 5 years. So congratulations to all the laboratories for getting this done. Now, in the National Laboratory Policy, which states that the policy of our laboratories is to provide an equitable and accessible quality laboratory service, that it sets out a number of outcomes of things that we should create. And I think one of the things that you'll be doing today is asking yourself, have we achieved all of these outcomes? That's one of the very important questions that we'll be asking today. And I think there were about, let's see how many outcomes there are here. There are about 5 different outcomes that you'll have to reflect on over the course of today's discussion. The first is about creating a commitment to quality. A commitment to quality. Have we created a commitment to quality? Commitment is something that you don't have to be forced to do. When you are committed to do something, you do it out of your own naturally wanting to do it. That's what commitment is. If you're committed to do something, so nobody has to crack a whip for you to do it. You go out there because you have that intrinsic desire inside of you to do it. So one of the things that we set out under this quality policy is to create that commitment to quality. That's a good question that we'll have to ask. Have we been able to create that committee? Because quality is really everybody's responsibility. To make it happen, it must become a commitment, a personal choice. Everybody in the laboratory, that this is something important and I'm going to commit to do it. That's the first thing that we created that commitment. The second thing that the outcome of the national laboratory policy is to create a coherent national regulatory framework for laboratory services. I think from some of the correspondence that I've been reading, I can see that some of it has been there. That is also something that you'll have to talk about. Do you have a national regulatory framework, and is it coherent? You know what the meaning of the word coherent is? Coherent means it all goes together, not some going this way and some going that way. Coherence, when things are moving together in the same direction. That means the process that you use in all the different laboratories, they're moving towards the same sort of direction. So coherence in the National Regulatory Framework for Laboratory Services. The third, which is very important for our ministry, because this is the backbone of our ministry. The backbone of our ministry in delivering health service is people. People. Without people, we can't deliver health service. So the third one is building human capacity for laboratory quality management service. Has our system been able to do that? Involvement of laboratory staff is a key determinant of a successful laboratory quality management system implementation. Employees' acceptance of and participation in the QMS should be achieved through system ownership, training, and knowledge sharing. That's the third outcome. The fourth outcome, very important. In a system, you must be able to capture things that is in people's head and change it to things that can be. You must change knowledge from being intrinsic to make it extrinsic, to make it explicit. In other words, things should not just be in people's head. It needs to be put on a piece of paper, put on SOPs, so that thing can become the knowledge in everybody. That's the importance of documentation. Things must be documented. And when things change, that should also be documented. The importance of documenting LQMS. Documentation is the backbone around which a quality management system is built. It helps the organization establish effective control over its processes and provides evidence of quality practices to its customers. And the fifth one is the monitoring, evaluation, and improving LQMS. I was very grateful that, was it last week, that I was at a function where we were launching the facilitator guide for monitoring and evaluation. Because I think that is something that we tend to focus a lot on implementation. Let's just get there and start doing things. Sometimes we don't focus enough on the planning bit to really think about what we do. Then we do it. Then to close the loop, you have to go back and do what? You've got to monitor and evaluate what you've already done. Because if not, you will not have that cyclical improvement. Right? To get that circle, to close the loop, to make sure that you have improvement, you need to do these three things well. You need to plan what you're going to do without just jumping immediately and start doing it. Do it well, then you must monitor and evaluate and learn from what you have done. That's the only way that you can have improvement. And that's what we need. We need continuous improvement. That's the only way to do it, to close that loop. Plan, do. In the old systems, in the shoe-hat cycle they talk about PDCA. Plan, do, check. Check, see the results. Find out what's good and then act. Change your systems, change your process so that you improve. And automatically you have the cycle of continuous improvement. So that's very important for quality management systems. I think at the end of today, during this workshop, you will have to be asking yourself, have we achieved all this? In which areas have we done well? Which areas do we need to improve on? Next question that we need to be asking ourselves, can we do better? Last night I was reading through your documents, call it the policies, the 3 documents that you gave me. I read them, very interesting. But I think today we'll be talking about how well we've been implemented. We should also be talking about, should we now redefine our planned outcomes? We had some outcomes before. When you set a plan, an objective, and an outcome, it's set in the sort of the situation that you find yourself in. As the situation changes, our planned outcomes also need to change to reflect our current situation. So one of the questions that you need to ask yourself today, should we now redefine these planned outcomes? And I think the next question that we need to ask ourselves, How do we sustain and improve this system, the quality management system? How do we sustain it? How do we keep it going? How do we improve it? And at the end of the day, we need to be able to answer those three questions. Is the system suitable? Suitable for our needs, for our level of resources, for the kinds of people that we have? Is it adequate for what we need? And is it effective? Is it delivering what we want it to do? I've made some notes here on some of the things that we need to do to sustain the system. How to sustain the system? Continuous quality improvement must become the heart of the practice in all of our laboratories. It must become the normal part of doing work. I think that's the important thing. It goes back to the initial thing that we talk about, commitment to quality and commitment to the system. It must become something that people see as an important part of their lives. I believe, as a ministry, we must invest in our quality systems right across the ministry. The ones that we have in the laboratory and the ones that we have in all other parts of the ministry. We must invest in and improve our systems and processes, and this will help us move sustainably towards the results we need. This is true for the laboratory quality management system, and it is true for all the other quality management systems we have in the ministry. We need to eventually look to external quality assurance to keep us moving forward. It's one good thing for us to look at it ourselves, although it can be a bit expensive to get others to come and assess us. But I think there needs to come a time when we need to start to get others to come and tell us how well we are. Because sometimes when we're looking at our own children, they always look lovely to us. But when others come, then they can pick out things that needs to be improved. I've been told, and this seems to be something right across the ministry, that in any system you need the people to be working the system. And one of our biggest challenges in this ministry is losing good people, staff attrition. And we can understand that. People can earn a lot of money outside of the ministry. I wish I could double a salary and double our budget and double everybody's salary. That's the fastest way of doing it. But of course, in any country there's always a competition for resources. So staff attrition is something that's going to happen. We can try to put a stop to it. We can try to solve the problem, but we can also look at ways we can adapt to the problem. I think in some cases, if we think the only solution to do this is just to increase everybody's pay to keep them here, because of the limited resources, is something that we can't do all the time. But I think the challenge for us, given that, how can we try to keep people, but then how can we innovatively adapt to that particular situation? Because staff attrition, the big problem with staff attrition is that they carry knowledge on their feet when they walk out there. They carry that competence. So the real problem is not staff attrition, but taking that competence that they have, that knowledge and that capacity, how do you make it available so that others coming in can also pick it up quickly? You get my point there? We can not always stop people from walking, from taking the intellectual capital on their two legs, but how can we capture what they know, what they can do, have it available so that you have a system of passing that on to others? It's called succession planning. Right? That's the term that we use. How do we make sure that for every person that has a certain level of competence, how do you identify people under them who have the capacity, the potential to take over their positions, and have a program to pass on what they know and what they can do, and pass it on to these potential people to take those positions? That's another system that we must have. I intend to be working on ways of looking at restructuring the ministry so that we can retain people in different skill sets. That's something that I've set up as a goal to do over the next few years. It will depend on budgets and all of those things. But I think also, together, all of us, we must also think out of the box in how we retain competence. Right? Not just in people, but in systems to capture that and pass it on to other people. The end result of this will be to improve our quality management system. And our quality management system, this is something that I've been stressing in the ministry, it is a subset of the Service Excellence Awards Framework, which I believe is something that we must work on strongly to improve the ministry as a whole. Okay, Service Excellence Awards Framework, it has been your ministry, Ministry of Health, has been winning this award for the past how many years? Last year you won the second highest level of these awards, but I believe that it's still not embedded right across, because obviously over here only 1/4 of you know what it's about. The Service Excellence Awards Framework is what we need to implement strongly so that we can lift the whole ministry in the next few years. In that in this Service Excellence Awards framework, it has 7 things. It says that you do these 6 things well, 6 things you do well, and the 7th thing will come. The 6 things that we need to have to improve the ministry is, first of all, strategic leadership. Having a direction, building a culture so that people know where we want to move this ministry. Strategic leadership. The secondly that we need to have is planning, which is what you're going to be doing today. There needs to be a lot of emphasis on planning. We can foresee a future and then we work to make that future happen. That's the second criteria. The third is something that's very strong also in this ministry. Talk about evidence-based decisions. Collecting data, converting that data to information, learning from that information so that it makes knowledge and making decisions on the basis of knowledge. Right? Data, information, knowledge. Then it's about people. How do we manage people? And about customers. 5th one is about customers. And the 6th one is about processes and operations. That is also, all of these things are covered in your quality management. A lot of them is covered. Processes and operations are covered. Customers are covered. I think people are covered. Data, information, and knowledge management. Those are also covered in the quality management system. So your quality management system is part of the overall framework that I believe, that I'm pushing very strongly, that we should look at this ministry to deliver the kinds of things that we want is in terms of our vision and our mission, which is very important for us.